Aligners are the latest trends in dentistry and they are getting popular with every single day among the public and your patients. I'm sure you get the patients who themselves ask for aligners nowadays. And today I'm going to talk about 3 very powerful secrets of successful and powerful teeth aligner consultation. Remember, if you really want to take the patients from braces to aligner treatment, upsell from braces to aligners, you should be very good and very effective at consulting the patients for aligners. And you need to learn the 3 things. The first is the aligners itself, the knowledge about aligners. The domain skill, the technical expertise of aligners is extremely important. I'll tell you something. Majority of us never learned about aligners when we were in our dental schools. And now when aligner as a treatment option is available, the problem is because we don't have the clinical expertise, the clinical knowledge about aligners, it becomes extremely difficult for us to talk about it correctly. I'll give you an example. Remember, you cannot give what you do not have. See, if I ask you 1,000 rupees and if you don't have money in your pocket, you cannot give me that. If you are someone who do not smile at people, people are not going to smile back at you. You cannot give what you do not have. So if you do not know the domain part, the technical part about aligners, it will become very difficult for you to convince patients for aligners and to answer all their questions. Suppose your patient asks, "Doctor, what if I forget to wear the aligner for 8 days? What should I do? What if I break the aligner? What if I lose the aligner? Will the teeth be 100% correct after the aligner treatment? Can you guarantee 100% success with the aligners?" So there are so many questions which patients can ask which are related to the technical expertise of the aligners, and because we don't have a formal technical education or knowledge, it becomes extremely challenging. Now the other extreme. Because we don't have the 100% expertise, many times we ourselves are not sure whether the aligners will be able to treat the complex cases or not. So when it comes to simple cases, you convince and you preach aligners to the patient. But when it comes to difficult cases, severe crowding, extraction cases, or the jaw discrepancy cases, you yourself don't talk about aligners to the patients, isn't it? Therefore, the first thing you need to do is to achieve the knowledge, the domain expertise which are related to aligners. Because unless you have the actual domain technical clinical knowledge of aligners, you will not be able to convince patients for aligners for sure. And that's the biggest challenge. So the first point, go and learn the domain part, the technical part about aligners. The second is learn the art and science of effective patient consultation. And I'll tell you why this is important. Remember, dentistry is an elective field. Except pain relief, nothing is mandatory, nothing is compulsory in dentistry. And therefore, many times you find that once the pain is gone, the patient is gone forever. The patients don't come back sometimes for 6 months, for a year, for a couple of years. Because dentistry is not a compulsive science. It's an elective field. And because it is elective, you actually have to convince patients for any dental treatment. And aligner definitely is not something which is related to the pain relief. And therefore, conducting aligner consultation is very difficult, very challenging, simply because it is not compulsive and moreover, it is costly treatment. So if you want to learn the art and science of patient consultation, don't think that you will learn it with time and you will become better and better with time. Even if you do, the problem is you will lose a lot of time in this learning process. The best thing to do is to learn the art and science of aligner consultation proactively. taking charge of your practice and become not just an effective communicator, not just become very powerful at patient consultation, but I always say you should do magnetic patient consultation. It should be so powerful, so convincing that patient should not say no, no matter what. And if you really want to learn the art and science of patient consultation, you can join my free webinar where I actually talk a lot about how to do that successful patient consultation and how to build a successful dental practice. I'll share the link of the webinar in the description below. Make sure that you attend it. It's free. And you learn the art and science of effective consultation so that you can use it for your effective aligner consultations. And the third important thing that you should learn is the language of aligner patient consultation. Remember, everything has its language. Every field has its language. Like for example, you read the newspaper and you see that the news which are related to politics, the political news has a different language. The financial news has a different language. The sports news has a different language. The spiritual columns has a different language. Not just that, in dentistry, every treatment has a different language when it comes to talking about the treatment and doing that patient consultation. Root canal has a different language. Implants has a different language. Aligners has a different language. Now you are able to convince patient for root canals and scalings and fillings very easily simply because you know the language of root canal consultation. You have mastered that language of root canal scaling filling consultation. But because we don't have the actual domain knowledge, we don't have any formal training in aligners, it's very difficult, it becomes very challenging for you to know and use the actual language of aligner consultation. Therefore, as you start gaining the knowledge about aligners, the theoretical, the technical knowledge about aligners, you will actually understand how to talk about aligners. That is where you learn the language of aligners. Once you learn the language of aligners, you become better and better at effective communication and effective presentation so that you are able to do that magnetic patient consultation and you will be able to convince the patients for aligners. I hope this video was very useful for you. Subscribe to my YouTube channel because I keep on sharing a lot of powerful content here. Put it in the comment box if you still have any questions about aligners or what should be my next topic of the video. I'll see you again. Stay tuned. Thank you.